The Democratic Club at Heritage Ranch recently held a Zoom session with Danielle Roberts from Boomer Benefits. This video highlights the information she shared.
It's a common assumption that when you blow out the candles on your 65th birthday cake, your healthcare costs disappear. You sign up for Medicare, and everything is covered. In reality, most people pay $0 for Medicare Part A, the part that covers hospital stays, because they've already prepaid through FICA payroll taxes. If you've worked for at least 10 years, you have essentially paid that premium in advance. Back when these rules were established in 1965, the system was designed to allow homemakers to get Part A through a spouse's work history, keeping that baseline coverage accessible for a single-income household. Part B is different. This covers your everyday outpatient care, like doctor visits. Everyone pays a standard base premium for Part B. In 2026, that base rate is $202.90 a month. Assuming Medicare handles everything leaves you totally unprepared for the mandatory monthly bills required to keep your baseline coverage active for life. That $200 baseline is just the minimum. If you had a higher income 2 years ago, the government adds a surcharge called the Income-Related Monthly Adjustment Amount, or IRMA. This can inflate what you owe for both Part B and your prescription drug coverage, with some enrollees paying over $600 a month. If your income dropped recently because you retired or experienced a life event like a divorce, you have to actively file an appeal with Social Security to get that surcharge removed. They won't adjust it for you automatically. Even paying for Parts A and B leaves you with significant financial gaps. At age 65, you face a choice between buying a Medigap supplement or choosing a Medicare Advantage plan. You need to get this right the first time. In many states, if you choose Advantage and later develop a health condition, medical underwriting laws make it nearly impossible to switch back to Medigap. You are choosing a lane. Once you decide how you want to receive your health care, you are largely locked into that system. Let's look at Medigap first. These are private supplemental policies designed specifically to cover the deductibles and copays that original Medicare leaves behind. The primary appeal here is absolute freedom. You can see any doctor or specialist in the country that accepts Medicare without ever asking an insurance network for a referral or prior approval. To get that freedom, you pay a high monthly premium up front. In return, the policy steps in and pays almost all of your back-end hospital and outpatient bills. Your only out-of-pocket medical cost for the entire year is your Part B deductible. The catch is that these premiums do not stay flat. Carriers are currently passing massive financial strain onto consumers through annual rate increases that regularly hit 10 to 20%. This chart shows how that monthly cost compounds steeply over time. A premium that feels manageable at 65 can become a serious budget strain by the time you're 80. Medigap offers total peace of mind and complete medical mobility. It remains a high-end choice for those who can afford an endlessly inflating monthly bill. If a high monthly premium isn't an option, the alternative is Medicare Advantage, or Part C. You've seen the ads promising $0 premiums and free gym memberships, but behind that marketing is a strict HMO or PPO network. You must use their specific local doctors, and those networks can change every year. Advantage plans also require prior authorizations. Before you can get an expensive surgery or procedure, the insurance company has to review your doctor's paperwork and approve it. The biggest risk of an Advantage plan is the out-of-pocket maximum. In a worst-case health scenario, the law allows these plans to leave you responsible for up to $9,250 in sudden medical bills in a single year. This matrix shows exactly how these paths compare across premiums, limits, networks, and approvals. The financial structures are inverses. Medigap charges high premiums to guarantee low costs later, while Advantage charges nothing up front but exposes you to costs later. With Advantage, you trade guaranteed monthly budget savings for the threat of heavy medical debt if you ever get seriously ill. Part D covers your prescriptions, and it carries its own set of high-stakes rules. If you skip enrollment because you're healthy today, you'll pay a monthly penalty every single year after you eventually sign up. The government recently capped Part D out-of-pocket costs at $2,000 a year to protect consumers from catastrophic pharmacy bills. But because insurance companies now have to cover everything above that $2,000 mark, many carriers are simply fleeing the national market. This graph illustrates the fallout. As the out-of-pocket limit drops to $2,000, the number of companies willing to offer drug plans drops right along with it. The carriers that are sticking around have to make up their margins somewhere. They are raising premiums and restricting which drugs they cover, which means you have to rigorously review your policy every single fall. Your drug costs might be legally capped, but the shrinking Part D market means you have to constantly defend your coverage from being dropped or quietly priced out of your budget. So, how do you actually make this choice? You have to map these industry rules to your specific financial and physical reality. Let's start with someone who has high medical needs, or a snowbird who travels frequently and requires access to specialists in multiple states. For this profile, Medigap is the logical answer. Accepting those inflating monthly premiums ensures you can get the complex care you need wherever you are. On the other side is the fixed-income retiree. If you are living on a strict budget, paying over $200 a month for a Medigap premium simply isn't mathematically possible. In that case, Medicare Advantage is a necessary reality. It provides functional, localized coverage, provided you do the diligent annual homework to make sure your specific doctors stay in their network. This chart shows how your budget and your health dictate your best option. Medigap aligns with high wealth or high medical needs, while Advantage fits those who stay local and operate on a fixed budget. Choosing the right plan means matching these industry trade-offs to your personal combination of wealth and medical needs. Many people find themselves stuck in the middle. You need the low monthly premiums of an Advantage plan, but you are terrified of getting hit with a $9,000 out-of-pocket medical bill. There is a strategic solution. You can pair a zero-premium Advantage plan with a low-cost hospital indemnity or lump-sum cancer policy. These inexpensive mini-policies pay you cash directly if you are hospitalized or diagnosed with a serious illness. That cash neutralizes the Advantage plan's biggest financial loophole by covering your out-of-pocket max. To build a strategy like that, you have to ignore the deceptive TV commercials. Those celebrity endorsements push subpar localized plans, and they will never offer you these strategic pairings to hedge your risk. The Medicare system is far too complex and financially punitive to navigate alone. Working with an independent professional ensures you don't get trapped in a plan that refuses to cover your needs. The modern Medicare landscape is defined by tight financial squeezes and shrinking options. But with proactive, strategic planning, you can preserve both your long-term health and your life savings.